Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, Vitamin K1 versus K2. Which should you take for stronger bones? Break key takeaways. Vitamin K is essential for overall health, but vitamin K2 plays a more specific role in bone health. Food sources and supplements can both help increase vitamin K intake, but always consult a healthcare provider before starting supplements.While both forms contribute to your health, vitamin K2 is more strongly tied to maintaining bone health and reducing fracture risk. Break vitamin K1 and vitamin K2 are two types of vitamin K. While both play important roles in the body, vitamin K2 is more strongly associated with supporting bone health. Break. Which is better for bone health? Break. According to research, there is a more consistent benefit with vitamin K2 than with vitamin K1 when it comes to bone health. Break. Research has shown that vitamin K2 plays a major role in bone formation and appears to be the most effective form in increasing bone mineral density and reducing fracture risk. Vitamin K2 supports bone metabolism by activating proteins that regulate how your body uses calcium and direct it into the bones. Vitamin K2 may be useful for radon prevention or treatment, along with vitamin D and calcium, for osteoporosis. This may be especially beneficial for older adults and postmenopausal women. Vitamin K1 versus K2, how are they different? Break. Vitamin K is a group of essential fat-soluble vitamins that share a similar chemical structure. Vitamin K is known for its role in blood clotting, which prevents excessive bleeding. It also helps direct calcium to the bones while preventing its buildup in the arteries, supporting both bone and heart health. Break. Vitamin K is divided into two main forms, vitamin K1, phylloquinone, and vitamin K2, menaquinones. While they share some similarities, they are different in the following ways. Break. Food sources. Vitamin K1 is mostly found in leafy green vegetables, while vitamin K2 is present in fermented foods, dairy, and meats.Absorption. Dietary vitamin K2 is considered to have a higher absorption rate than K1. How long they last? Vitamin K2 lasts longer in the body. Some forms of vitamin K2 can last several days in the blood, while vitamin K1 typically lasts for several hours. Related stories understanding vitamin K2 and its health benefits. 20 tasty vitamin K-rich food less than speak greater than S to incorporate into your diet. How much vitamin K do I need? Break. The recommended adequate intake (AI) of vitamin K for adults is 90 micrograms (mg) per day for females and 120 micrograms per day for males. This is the total amount that should be consumed daily, including both diet and supplements. Break. AI is used when there is insufficient evidence to establish a recommended dietary allowance, also known as RDA. Break. Food sources. Break. Getting enough vitamin K through your diet is an important step in supporting strong bones. While vitamin K1 primarily supports blood clotting, it also contributes to overall health. Vitamin K2 is less commonly found in the diet but is more strongly associated with bone strength. Break. The top two forms of vitamin K come from different types of foods. Getting enough of both forms is a good idea to optimize their health benefits. Break. Vitamin K1. Break. Broccoli. Break. Collard greens. Break. Kale. Break. Spinach. Break. Vitamin K2. Break. Beef. Break. Certain cheeses. Break. Chicken. Break. Egg yolks. Break. Fermented foods, like natto, a traditional Japanese soybean dish. Break. Given that vitamin K2 is more difficult to obtain from food alone, some people may consider taking supplements. Discuss supplementation with a healthcare provider if needed. Do I need to supplement with vitamin K2? While many people obtain sufficient vitamin K through a balanced diet, some individuals may benefit from supplements. The following groups may benefit from vitamin K2 supplementation. Postmenopausal women, older adults, people with osteoporosis or low bone density, people with conditions or who take medications that affect vitamin K absorption. Break typical doses studied for bone benefits using vitamin K2 supplements range from 90 to 200 micrograms per day, but it's best to follow guidance from a healthcare professional if you choose to supplement. Break vitamin K supplements are generally safe for most people, but certain groups should heed caution and consult their healthcare provider before starting supplements. These include break people taking blood thinners, since vitamin K can interact with blood-thinning medications like warfarin people with clotting disorders, people with liver disease, people with fat-malabsorption conditions like celiac disease and cystic fibrosis. Break always talk to your provider before starting any new supplements like vitamin K, RxC_speak. Speakcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. _speak.